Hello, my name is Nurse Pauline RN. Welcome to my channel. The title of my video today is about anxiety. We will be covering anxiety, generalized anxiety, and alcoholism. Please hit the like button, please subscribe, and please share this video. We are starting with questions and answers taken directly from nclex-rn examinations. Our first question is about anxiety. Anxiety symptoms can result from physiological conditions. Give examples. We spoke about this in one of my previous videos, and the correct answer is COPD, hyperthyroidism, and hypoglycemia. Our next question is, what assessments supports the diagnosis of anxiety? 1. Correct answer: client experience anxiety level that affects functioning in more than one area of life for 6 months. The second correct answer is anxiety affects 2 areas such as social, occupational, or other important function. Our next question is, a new patient admitted to the inpatient psych unit. What would be your priority nursing diagnosis? The correct answer for patients admitted to psych unit is priority, correct answer, risk for self-directed violence related to depressed mood. Please note, safety is always priority for patients who are newly admitted to inpatient psych unit. My next question is about generalized anxiety assessment. My question is, what is the assessment that validates the diagnosis of generalized anxiety disorder? The correct answer for your assessment will be client experience excessive worrying about items difficult to control. Client experience excessive worry about items difficult to control. Our second correct answer, client experience increased startle reflex, increased tension and feelings of being on edge, trouble relaxing, hard to sit still, irritable, afraid something will happen. These are your assessments for patients with generalized anxiety. My next question is, client with generalized anxiety is thinking of suicide. What would the nurse do for client thinking of suicide? Client with generalized anxiety. The correct answer is, ask the client about a plan for suicide to evaluate tension, to evaluate safety risk is your correct answer. We're talking about generalized anxiety, and we're talking about these patients are at risk for suicide. Here is my question. Client with a completed plan for suicide what are they at higher risk for? Clients who have a completed plan for suicide, higher risk is the correct answer. These clients with a plan is at risk for suicide. These plans are already completed. They are at higher risk for suicide. My next question is about a patient who is an alcoholic. What do you know about thiamine deficiency in patients with alcoholism? The correct answer is thiamine deficiency is a major problem for clients diagnosed with alcohol dependence, which is life-threatening. My next question is about an alcoholic patient who has alcoholic dementia. The question is, client is diagnosed with alcoholic dementia. Which intervention is appropriate for this client with nursing diagnosis, altered perception? The correct answer is, for intervention for these patients with altered perception, nurse would decrease environmental stimuli. Nurse would decrease noise level on the unit. Nurse would have fewer people around clients with alcoholic dementia. They have altered perception. For clients, nurse will keep all decorations for these clients simple. We have questions continuing on alcoholism. Your question is, client with history of alcoholism diagnosed with peripheral neuropathy. Which nursing diagnosis addresses client's problem? The correct answer is pain related to effects of alcohol as evidenced by complaints of pain. This patient has peripheral neuropathy. Please note, peripheral neuropathy is characterized by peripheral nerve damage resulting in pain, burning, tingling, pricky sensation of extremities. These are signs of patients with peripheral neuropathy, and we have pains relating to the effects of alcohol. Please hit the like button, please subscribe, please share. This ends part 2. We will be moving on. My next video is on part 3. Thanks. Have a good day. Take care.